as opposed to providing the instruction in the classrooms or in a person teaching environment. So this is the part we can be able to make it successful. Virtual reality simulations is the powerful training method for the ensuring the clinical or clinician preparedness. So this is the one of the training programs as we can be able to deliver to the people those we require. Go to the next slide, please. Here, the common virtual nursing task we can be performed through the virtual training programs like admission database, how to take the admission to the hospital or community centers. Discharge teachings, we can be able to make it through the virtual training programs. Out the patients after their surgeries and all, after the discharge, particularly into the part of hospital or centers, community health centers, they can be give the teaching them. Medications, reconciliations, completing the procedures checklist. We can be make the checklist easily in the performing virtual training programs that students can be able to make out, or the either the patients, those who are in the part of their list, we can be able. Second, nurse sign off or the medication or skin check, we can be through the this digital mode, we can be able to how to check the skin disease and all that. We can be, it is the part of their our digital mode. General education for the patients, we can be able to make such educations like health educations that maybe the patients may be related to the dietary or related to the exercise, related to their maybe certain kind of activity, we can be performed through the virtual mode. Contacting the families, those far from the particular center or cities, that we can be able to make and counsel the families, maybe according to their requirements, answering the questions, and many more aspects we can be able to perform through the virtual training. Go to the next slide, please. There are certain advantages of virtual training like opportunity to gain hand-on experience. You know that our experience can be more in the part of you if you are connectively to the remote regions with the virtual choice. So that is the virtual, we can be able to make them as such. They can ask, there are certain questions into the remote area those people may have. Do not pass through the waiting rooms like patients are coming to the hospitals. That in the OPD itself, we can see that long queues. That long queues may not be able to patients wait for the particular aspects or particular patients go for the particular physicians. In that situations, the telehealth can be help out, directly contact with the physicians or healthcare workers. Better availability of healthcare. Obviously, this is the part, maybe make out such kind of health facilities in our scenario, in our centers, that health facilities we can be performed that people may not be able to come, that people have to be followed by the giving the advise them, health education them, educate them, certain aspect of dietary recommendations and all the aspects in the health education regarding we can provide through the our systems. Care expenses decrease. Obviously, the patients come from far, that maybe require the transportations, or that maybe that allow to come for the either vehicle, any kind of vehicles, require the expenses that patients cannot be bear. Certain people may not be bear. So that situations can be helped out by the telehealth. But in the telehealth also some of the limitations will be there. Go to the next slide. There are certain
अभी AI हमारा कितना हमारे लिए यूजफुल है, इवन द हॉस्पिटल सेक्टर, कम्युनिटी सेक्टर और एजुकेशन सेक्टर। AI का जितने भी डाटा है या फिर उसका जो एक्यूरेसी है वो बहुत ही चेंजेस है। इवन ह्यूमन ईरर को भी क्या करता है, वेरीफाई करता है। तो इसीलिए AI हमारा अर्ली डिटेक्शन, अर्ली प्रिवेंशन या फिर ट्रीटमेंट, इंटरवेंशन, इन्वेस्टिगेशन, हर एक चीज में AI क्या कर रहा है, हेल्प कर रहा है। यदि आप लोगों को प्रेजेंटेशन बनानी है या फिर आप लोगों को असाइनमेंट करनी है या फिर आपको कुछ नोट्स चाहिए, AI से आप हेल्प लेते हैं ना। तो ये सारी चीज जो AI है वो अभी अर्ली डिटेक्शन में, डिजीज को प्रिवेंट करने में, डिजीज को इन्वेस्टिगेशन करने में, हर एक चीज में AI का बहुत बड़ा योगदान है। सेल्फ मोटिव, यदि हर एक इंडिविजुअल अपने हेल्थ को खुद ही ट्रैक कर पाएगा, खुद ही मॉनिटर कर पाएगा, तो उसको पूरे दिन में उसका ब्लड शुगर किस टाइम पे बढ़ रहा है, किस टाइम पे घट रहा है, या फिर उसका ब्लड प्रेशर किस टाइम पे हाई हो रहा है, किस टाइम पे लो हो रहा है, हर एक चीज वो क्या करेगा, सेल्फ मॉनिटर करेगा। उसको पता चलेगा कि मेरे क्या खाने से मेरा क्या हो रहा है, ब्लड शुगर बढ़ रहा है, या कि मैं कौन सी ऐसी कार्डियो एक्टिविटी कर रही हूँ जिससे मेरा ब्लड प्रेशर हाई हो रहा है। तो ये सेल्फ मॉनिटरिंग सबसे बड़ा एक हमारा ऐसा यूजफुल चीज
we need to know is that health is a top priority for any government. See, health is affected by various determinants, including social determinants. So we know that health is affected by physical and mental and other determinants, but social determinants play an important role, especially to make the policy and do the advocacy. So understanding the relationship between health and health policy is of vital importance, as it is possible to tackle some of the major health problems. And we know that COVID-19 has really updated us with all these thoughts, how much the policy had played an important role in tackling the disease. So before we start, let us just recall every information regarding what is policy and what is advocacy. Policy is a deliberate set of principles to guide decisions and guide rational outcomes. A policy is a statement of intent and is implemented as a procedure or protocol. So policy is very important. Every hospital, every community setup, every education needs a policy, because any person who is joining the institution or a government setup has to have a guided principle. So only policy or policy manual plays an important role. So we need to have policy and advocacy. So the key components of a good policy is that it should be a forward looking, it should guide you. So it should be forward looking, it should be outward looking. That means it should not only guide you to be inside the institution.
हम कोशिश करें कि उनके थ्रू जो भी ज्यादा से ज्यादा इंफॉर्मेशन है, जानकारी है, वो गांव में रह रहे लोगों को या कस्बे में रह रहे लोगों तक पहुंचा सके.
Next, process evaluation. It includes implementation fidelity, like monitor how well the program is being implemented. That also have to be monitored. Otherwise, it is going to be the waste if you do it at. So periodically, it has to be evaluated. And participant engagement, how many people are attending, how many people are leaving. See, they might be coming, in between they will drop. That you have to find out the reason and insist them, motivate them. And barriers and challenges, identify any obstacles that might affect program delivery. You might have a lot of obstacles. So people, they might come, they cannot come from different places. They can't come and attend. In that condition, ask transportation. Many people are ready to give free transportation. Request them to drop and pick up those people. Even people may expect some refreshment. Ask certain companies to give certain refreshment in between the program. That is going to help for retaining and completion of the task. Then outcome evaluation, that is knowledge gain. You are done. How much knowledge they have got it. And behavioral changes, measures whether they have been changed in their behavior among the participants through your health education, health behavior, that adopting healthier eating habits, increasing physical activity, and seeking preventive health services. Ask feedback, you take it. And health outcome. What is the outcome of that? See, you have taken around 100 people under your program, and you insisted them to do a daily physical activity and good nutritional diet. Then do investigation. I mean, after particular days of your interventions, if their weight is reduced, see the physical activity were very effective. And if the case was known of hypertension